In Chapter 5, we're going to take a look at the creation and the thought process behind evidence-based practice in medical surgical nursing. Recall that every research stance comes from a question that has been posed. So we're going to go through that process on Chapter 5. So with evidence-based practice, one, as a healthcare provider, must understand the use of evidence-based practice approach. So looking at evidence-based practice, it says that evidence-based practice is the practice in which a nurse makes a clinical decision using the best available research and other evidence that is reflected into approved policies and procedures and clinical guidelines, in particular to the healthcare agency. So basically, you're utilizing what people have researched and have proven to be effective for the patient in their care. So you want to utilize that. Also, incorporate current best evidence with expertise of the clinician and patient's values and preferences to make healthcare decisions. So you have to look at not just what the research says, but you have to look at the patient. Remember, because we want to include the patient with our DEX, our differential essential competencies. We want to make sure that we are including our patient in that patient-centered care. So we're going back and looking at their culture. We're looking at their preferences for their care to see if it can align up to what we know to be true on how to take care of them so that they can get the best results. The third one, is applicable to nursing and other healthcare disciplines. So there are some things that we do in nursing that we utilize for evidence-based practice that are not key to our discipline, but it's stretched out over the continuum. So it's used inside the interdisciplinary team. Also recall that evidence-based practice is a collaborative practice. So we utilize this practice, again, not just in nursing, but we utilize it with respiratory therapists, with physical therapists, with occupational therapists, with physicians. So it is a collaborative process on how we take care of our patients. So within evidence-based practice, there are steps in which comes to mind as a systematic approach for establishing evidence for a certain thing. So initially what happens is practitioner has a question. The question usually comes from taking care of a patient. One of the questions you may come in contact with is when you're taking care of a patient, what else could I have done to prevent this patient from falling? Or what else could I have done to prevent this patient from getting the wrong medication? What else could I have done to prevent this patient from having the wrong diet tray? In which, even though it sounds subtle, if my client is a diabetic and they get a regular diet tray, then it could cause some complications within their disease process, and we may have to increase the amount of medication that we give them at that point in time. So what can we do to correct a problem? Or what can we do to improve something that we're doing at this time? Because we have a different patient that has a different culture and different thought processes and beliefs. It's not just with patients. Evidence-based practice, that clinical question can come from existing policies. So should we actually run blood over 2 hours? Or should it be less than 2 hours? Have we come across that if we run blood at 2 hours per unit, is there more clotting, or is there more reaction, or is there a better response? So sometimes it's how policies are written in the facilities, in which may change what we're doing currently. That's where your question may come from. The other thing is, when you're looking at questions, what type of question is it? Is it a qualitative question or is it a quantitative question? When you're looking at qualitative and quantitative questions, a qualitative question focuses on the meaning and the interpretation of the human phenomenon or the experience of the person. For an example, what is the experience of having cancer like to a young adult? So you're looking at the experience. A quantitative question is more so in relationship between or among a measurable phenomenon, and it includes more objective approach to both data collection and analysis. So those questions that you'll be asking with quantitative is, What is the effect of using a new assessment tool to predict the likelihood of falling to the frequency and severity of falls in a patient undergoing a hip replacement? So you actually have a number to compare it to. So that would be something that you would utilize for a burning clinical question. There's a format that we utilize with evidence-based practice. It's called a PICO format. And the PICO format actually includes different things within your question. So you have a population, which indicates the specific group of the patients that you will be utilizing or that the question applies to. The intervention component, okay, so that's your I. That may pertain to like any types of new therapies that may support the evidence that you're utilizing. C is your comparison, a component of the clinical question that may be either a standard or current treatment. And then O is your component of your outcome. So the specific measurable and desired outcome of your practice and innovation. So a lot of times you'll see it written as that. When you're utilizing other things about your questions, you want to ask is, has this already been researched? And then utilize the research that has already been done in pertaining to that same question you may have. You want to find the best evidence available to try to answer the question. Number 3 is critically appraise and synthesize relevant evidence, like I just said. And with that being said, when you critically appraise and synthesize relevant evidence, you may find to see that your problem has already been solved, but the facility is not currently using that research to back up what they're doing. So they're in habitual practice, but there's a better way to do it, and you may actually find the solution to the problem without going further in the process of formulating your own research to solve this burning question. In this slide, it talks about steps by evidence-based process, and it's a continuum. Step 4 is to make recommendations to your practice to improve. So recall that it is your responsibility when you find that there's an issue in your practice. Of course, there's like quality and safety improvement nurses that are all employed at your facility to make everything better. However, if you are a healthcare provider, it is your responsibility to recommend improvements for your facility and gather that information and give it to your quality assurance nurse so that they can start the process. It's almost like you telling somebody, hey, there's a problem, like there's a light bulb that's out in the break room. And you're just saying that there's a light bulb that's out in the break room. But you have the ability, number 1, to search to see if we have any other light bulbs. And you have the ability to change the light bulb yourself. So if you find the light bulb, then you can change the light. But if you cannot find the light bulb, at least you would go to the quality assurance person or nurse, and you would let them know, I searched and I could not find the correct light bulb to fix the light, but I know that the light is out. So you're establishing that there's a problem, and then you did something. So you intervene, like we're supposed to do as nurses, to help solve the problem, but you couldn't solve the problem because you needed more information. So you try to make improvements to the practice by at least intervening in some means. And then you can implement the accepted recommendations if the facility has found that there is research behind what you're saying to back it up, to improve patient care, to improve the patient being more involved, to improve communication between the interdisciplinary team. So that's something you can do. And then, of course, evaluate your outcomes. So going back to the light bulb, if I decided to change the light bulb because I found a light bulb somewhere, but it wasn't the same light bulb, did it provide the same light that the previous light bulb provided? Or is it dim? Or is it better? Okay, so you got to look at your outcomes, almost like a nursing care plan. You know how you have your goals and you go back and you evaluate your goals. And how you evaluate your goals is it has to be measurable, as well as you have to see if your interventions help. So you have to do something with evidence-based practice if you see a problem. So this slide gives you just a summary of basically what I was talking about in the previous intro slides. So your burning question, and we're just going to review this real quick. A burning question, a clinical question, usually has something to do with when you're in practice and if you're taking care of somebody and their family may ask the question, or if you're among a group of nurses and you guys all come to the same conclusion. So it can arise from a patient group of population, a patient care unit, or it could arise from a large organizational unit. This slide reviews the difference between a qualitative and a quantitative question. Please review the definitions. I've already mentioned it in the slides above and giving you a comparison to what they look like and what the examples are. This slide is just reviewing what I talked about earlier in the PICO format on basically the things that you would frame your questions off of. So we're going to review it one more time: population, intervention, comparison, outcome, and time. It is the level of evidence. When you're looking at evidence-based practice, depending on what type of question you're asking, so for an example, we have level of evidence, JBI's levels of qualitative evidence and meaningfulness. So qualitative has to do basically with the experience and not the number. So when we're looking at qualitative evidence, the first level actually is the highest level, so it gives you more of a ground basis foundation for what is correct or what is incorrect. So you have a metasynthesis of research with unequivocal synthesized findings. So that tells you that, hey, there's been research done and here are the definite findings. Then you have level 2, and it says with credible synthesized findings. And then 3, you have the same thing. It says text or opinion with credible. So you see how you have research that's unequivocal, so it's certain. Then you have a research that's credible. And then you have text or an opinion that's credible. And then you have one or more single research studies that's highly of high quality. And then number 4 is your expert opinion. So that's just going off of somebody that's been in practice for a very long time and that has sufficient amount of education, and they have seen this question that you're asking. So they've seen this patient over and over again, and so they've had experience with these types of patients, and in their opinion, from their practice and their education, and their experience, that this is what should be or what should not be, or this is how it should be handled or not. But you see that's number 4, and that is the lowest one. So you always want to have some type of research to base how you are practicing off of, instead of it just being an expert opinion. Now you can take all of them and wrap them up into one great bow, and it'll help you come to a conclusion on how to take care of your patient. So that's pretty much it for the levels of evidence. Clinical practice guidelines, it says it's quality of clinical practice. This is what it established, and it is the official recommendation based on evidence to diagnose or to manage a patient. So I will tell you, clinical guidelines for physicians or advanced healthcare professionals, these are like their roadmaps, their Bibles, their steps to the gold pot at the end of the rainbow. So this is what guides their practice. This is what they know to do when a patient comes in with this disease process. And so your book says that it's preliminary evidence search entails of identifying whether quality practice or guidelines exist to answer the question. So the evidence-based practice is something that's utilized when there are gray. There's like this gray color between the guidelines. You don't have a definite answer on how to treat a person with this disease process. So it's not black and it's not white, but it's gray. And so this is where a lot of the research come in on how to take care of these certain disease processes, and especially like if you have a new disease process that comes into play. And we were talking about how obesity is like running very rampant, and a newer virus that we're dealing with is HPV, human papillomatosis virus. And so we don't have a lot of research in that field, but a lot is coming, and obesity is expanding. And so there's a lot of things that we don't know about it and how to treat it, and we may not understand it, like neuropathic pain. But continuation of research will lead us to what we need to do correct, and it will scope clinical guidelines on how to take care of these patients. So that's pretty much it about clinical guidelines. So in your research, to see if whatever you're looking at, your question that you pose, in trying to find what is evidence-based and trying to find more information about this problem that you have posed, well, we have some fantastic databases that are available to you, and we actually have these in the library that you can go and utilize and look up disease processes and treatments that you're quite unsure about, or that you feel like you were in practice and they gave a medication that was off-label. Off-label means that it has not been approved by the FDA to administer that medication for that certain disease process, but they do it anyway and it works. So you can take these databases, look in these databases to guide your clinical practice, to make sure that you know that the reason why we're utilizing this medication, it will ultimately help this patient's disease process. And you can actually explain to the patient that, you know, the reason why, if you have a migraine, we're giving you amitriptyline, which is a tricyclic antidepressant. The reason why we give you that medication is because it decreases the bouts of serotonin. And the serotonin, we know that when you have an increased amount of serotonin that's actually resting in the blood, it can help. It can make the migraine worse. So if we decrease that serotonin, then it's going to pull that migraine or cause that vasodilation to decrease in a sort, because you don't have that neurotransmitter kind of running through your bloodstream. Basically, that's really what's going on. It's not connecting to those receptors and causing that stimulation. But many people don't know that, and many people don't understand that. Also, why do you give a beta blocker for a migraine? People haven't understood why that's giving prophylactically. But if you give a beta blocker, remember the beta blockers, you have a beta 1 and beta 2, and then you have a beta 3. Well, you got to think about what the action of the medication is doing. So what is the beta blocker doing? Well, it's slowing down things in the body, like the heart rate, but it's also doing what? If it's slowing down the heart rate, then it could be possibly causing vasoconstriction in some way, shape, or form. So that's something that you want to think about when you have a patient that is on a beta blocker, because if they have migraines and they're taking a beta blocker for migraines, then you got to think about the side effects or the effects of the medication. So it's going to decrease their blood pressure, as well as it's going to decrease their heart rate. So if you're wondering why, you know, a 32-year-old is on propanol and their blood pressure is totally fine, they haven't been diagnosed with hypertension, it could be this. Research it. Go to these databases. Medline, I love PubMed. But go to these databases and type in the search what you're looking for or what you came across, and see if research has been done and what type of research has been done, because it could be quantitative and you're looking for a qualitative perspective. Okay, so these are available to you. So this slide talks about critically appraising the synthesizing evidence. So once you have researched and you come up with certain articles that are out there about the disease process that you're looking for, or about the population that you're looking for, then you want to collaborate with your team. A lot of times that you'll pull off different types of articles, and then you'll take those articles and you'll summarize those articles. So certain team members will review the articles, and then you'll come up with a consensus. Basically, what did the article say was best for how you should answer this question? And then across the board, you guys collectively come up with your thoughts on how to answer this clinical question in regards to the research that is out there already. If there is none, then you set yourself up for doing a research study. So basically now is your time to shine, because you're at a point where you've gotten the team all involved in this problem. You've done your research. So now you can make recommendations according to the research that you have found to your facility. So you can actually make a difference. With that being said, you would want to make a written recommendation of how you see that this question could be answered, or this problem could be solved, or this thing that we're doing, this practice that we're doing currently, could be improved at your facility. All right, so now it is time to implement the recommendations that you have came up with through your due diligence of researching this issue. So, of course, there will be a protocol and a policy written according to this implementation plan. Hopefully, with everything that you've done and all of your hard work, it will improve the practice and the patient outcomes and your desired outcomes. But something that must be key is that in this implementation process, know that it may take a prolonged amount of time, but it should be systematic, shared, and consistent. Okay, so in evaluating your outcome for your patient, that this question that arises, it may require that you have valid and measurable tools that you need to utilize according to the specific question that you're asking. Some of those tools are available for you, and so you would do your research, you would gather the tool that is specific to what you're trying to answer, and you must be mindful because sometimes you have to ask for permission to utilize their tools. So ask for permission, and a lot of times it's sending the publisher an email and stating, you know, what your thought process is and what you're utilizing the tool for. And then also you want to include your patient in your evaluation outcomes too. So if there is going to be information that is revealed about your patient, then sometimes you have to get their permission as well. But other than that, utilize the necessary tools that have been approved for your concerning question to evaluate your outcomes, because you always want to make sure that whatever you're doing according to the research that you've gathered is basically something that is needed and is something that's making a difference. So let's take some time to look at these questions. So nurses should practice according to evidence-based practice principles, because EBP, what does it do for us? Let's see. It uses current best evidence to include patient values and preferences in making healthcare decisions. So D is the correct answer. This next question. A nurse wants to know whether the use of moist heat or wet heat is most effective in reducing a patient's pain when starting an IV catheter. What is appropriate, or what is the appropriate intervention the nurse should then take to answer this clinical question according to evidence-based practice principles? So the correct answer is to complete a survey of the nursing staff about what method is most successful for placing IVs. This is a true or false question. True or false? Evidence-based practice ensures that current and best research guides health care interventions. That is actually false. It says, although valid and reliable research is essential for evidence-based practice, the scope of evidence-based practice is used to guide patient care and is more broad and includes patient values and preferences as well as other forms of evidence besides researched evidence. Okay, so remember the levels that we talked about? So it includes more than that.